for a year now since being reassigned to COVID and working on faith communities. So we welcome her today and be thankful that she's joined us, and she's a Lutheran too. So
I am. Do you want me to start?
Yeah, I think just remember everybody's on mute, and type your questions into the chat, or at the end we can raise our hands. All
Okay.
right, sounds good.
Great.
All right, and then I'll just talk about the vaccine and stuff at the end.
Okay, great. Thank you. Thank you. Well, welcome everyone. Thank you for inviting me to be with you today. And I'm so glad you're able to join with us. As I said, I'm Wendy Berghorst. I'm from Department of Health. I initially, or my job is well, I'm a public health nurse by background, and was primarily working with children and youth with special health needs. But when COVID started, they made a special branch at MDH called the Cultural, Faith, and Disabilities Community Engagement Outreach Branch. And so really we have a variety of staff that have been pulled from various areas that are really working on how we can better communicate and support all communities within the state of Minnesota. So part of it is we've been doing a vaccine 101, and people have been asking, a small team of people, to do this presentation. So that's part of where we're at today. So I'm going to talk a little bit about vaccine concerns, questions, sort of a vaccine 101, how to get the vaccine, how safe it is, finding it, getting vaccinated. So one of the key things that we're really acknowledging right now is that each community owes its existence and vitality to the generations from around the world who contributed their hopes, dreams, and energies to making the history that led to this moment. Some were brought here against their will, some were drawn to leave their distant homes and hope for a better life, and some have lived on this land for more generations than can be counted. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. And so we're beginning this effort to really acknowledge what has been buried by honoring the truth. We are standing on the ancestral lands of Dakota people. We want to acknowledge the Dakota, the Ojibwe, the Ho-Chunk, and the other nations of people who also call this place home. We pay respects to their elders, past and present. And so please take a moment and consider the treaties that were made by the tribal nations that entitle non-Native people to live and work on traditional Native lands, and consider the many legacies of violence, displacement, migration, and settlement that bring us here today. And part of this is that we're really trying to uncover such truths at any and all public events and acknowledge how we have continued on some of these paths and how we can start to address them more fully. So the statement, or the state of Minnesota and the Department of Health, recognize that trauma, medical abuse, and discrimination has happened to all of our communities, Black, Indigenous, people of color, disability, LGBTQ+, which has led to distrust in medicine and public health. And so part of this is why I'm here today too, is really to work with you to actively work to build retrust with our communities and bring members' voices to the table. So how do we go forward? Part of it is by recognizing and giving voice to the trauma that we're seeing in our community, the importance of showing understanding and compassion, looking at the issues from different perspectives, and then just what is, and really taking some ownership of being as an employee of a public health agency. How can we support transparency, open communication, get community input, and really build trust? So we just really acknowledge that transparency is really critical to this process, and really want to know that decisions are being made that really impact all of us, and hopefully are for our safety, or your safety, your family's safety, your community's safety. So I just added this one too, because it's just like, let's look at where we've been. Just think about this past year. COVID-19 has been the greatest public health crisis of our lifetime. We have the governors all over issuing orders to protect the public at varying degrees. We have closures and openings of faith organizations, venues, schools. We have masking and distancing. And we have people that are really looking at preparedness plans within each of their organizations. But I'm sure many of you have had people or friends that have been sick with it. Many of you have lost some people. And I think when you're personally touched, it really does make a difference. But we know that through work, school gatherings, faith settings, everything has changed and we're tired, we're challenged, and everyone's still adjusting. So we're gonna talk a little bit about the virus and that it's safe and effective. So vaccine 101. Now it's just grounding, move on to some of the vaccine basics. And I just added this came through this last week. It's like, I don't need the vaccine, they said, while enjoying life without polio, tetanus, hepatitis, hep A, B, rubella, measles, whooping cough, et cetera, et cetera, et cetera, and a bunch of other stuff. I thought that's a great quote to start out with. Because it just really sort of says, you know, vaccines have been around for a long time. They really do help us from getting diseases such as flu, chickenpox. And so it's as we look at vaccinating a community, it really is, we're looking at preventing disease spread and keeping everyone healthy and really looking at herd immunity. And I don't know if you're familiar with that term, but I do have a slide near the end on that. So it's really trying to increase numbers within a community. So we know that they work. So it's a product. So a vaccine is a product designed to help prevent diseases. It includes some ingredients that gives a person's body a sample of either the virus or bacteria so the body can learn to fight the disease. And there are a couple of different ways that vaccines are made. They can include a whole germ inside the vaccine. They can be part of the germ, or it can even use no germ at all. So each of these are different ways that the vaccine is developed, and the vaccines don't make someone sick with the disease, but they can cause side effects. So that two, Pfizer and Moderna, are no germ vaccines. I included this just to give you a little background. They call it a messenger ribonucleic acid vaccine, but it doesn't contain the virus, does not create the virus, cannot cause the infection. It's a messenger. So it sort of tells your body that this is a foreign body, and it makes your body develop the antibodies to fight the germ. So it will protect you from the disease. And the Johnson & Johnson is also a no germ vaccine, and it doesn't create a virus or cause the infection. But it uses a weakened common cold virus to hold instructions for the body to recognize and fight it. And I'll talk a little bit more about what's going on with Johnson & Johnson in another slide. So it's not that you're giving anyone else it, but it's your body is, again, making antibodies and protecting you from the disease. So none of the COVID vaccines contain eggs, pork products, gelatin, latex, or preservatives. And they all, you know, with vaccines, you have the lipids, the sugars, the buffers, everything that's the liquids that are put into it to help buffer it and keep it safe and things. So to the steps to a safe and effective vaccine, we've all been watching, you know, when you do a vaccine program goal, we knew a year ago that they were going to start looking at vaccines and working on it. So you want to make sure that the vaccines are safe and that they work. And, you know, they pulled together vaccine companies, public health, vaccine experts globally to really work together to make this vaccine or to develop it. So as they developed it, two clinical studies were done. And here's a list of like the different participants in it. So they really wanted to check how is it working for everyone. So you have different race, ethnicity, various ages and health conditions that were included in the tests. And one of the biggest issues I know that people are going is, how could it be made so fast? And one of the biggest things is that, just to share with you, that no steps were skipped. And a lot of time, the different phases, rather than going longitudinally, phase 1, phase 2, phase 3, a lot of this was done concurrently. So there was some group that were doing phase 1, is it safe? There were also people at the same time working on, does it work? And then it's like, is it safe? And it works. So that's why it was able to go through this whole process faster. So with the FDA, I just want to reassure you that it was reviewed. And right now with the ACIP review, that's where the Johnson & Johnson has been put on hold. So we know that vaccines really help many people not get sick and for some to get less sick. That the vaccines prevented COVID most of the time, and it works in different age groups. And it's likely going to work for many of the new variants. And it's 2 doses in a 2-dose series, and then the Johnson is a 1 dose. And we know that it takes about 2 weeks after you get it to get fully vaccinated to build up your full protection. I just included this just because initially there was a lot of questions, but people who are pregnant can get the vaccine. Of course, you always want to talk to your provider, and the vaccine is safe for people who want to have a baby someday. So here's just the update and why everything was put on pause on April 13th, because it turns out, not here in Minnesota, but there is a very rare type of blood clot reported in 6 women out of nearly 7 million people, and one of them did die. So the states have put the Johnson & Johnson on pause as they continue to monitor that. So if you're one of those that maybe have gotten the Johnson & Johnson in the last month, if you get any headaches, abdominal pain, leg pain, shortness of breath within 3 weeks, make sure that you contact your doctor or go to the emergency room or urgent care. And if it's been longer than that and you're doing fine, I would assume you're going to be fine. So how do you find the COVID-19 vaccine? I think the messaging statewide has been a little confusing. I'll be honest with you, as a state employee, it's taken me a lot of time and energy to figure this out myself. Oh, I added this one. It's just like, so even though, well, obviously we have 3 vaccines right now, only 2 are being administered. So we know that eligibility really looked initially at who are at high risk, who do we really want to get, who's dying. So that was where we targeted the healthcare personnel initially, and people, long-term care residents, are elderly. And as they got immunized, then it started to open up where people age 65 years and older, and education and childcare providers. And then we went into March and they opened it up a little bit more if you had any specific underlying conditions, and there was a whole list of that. And now, as of March 30th, it went to every Minnesotan age 16 years and older is eligible to get their shot. So as we look at that, part of it is still access, is still an eligibility, and how do you get it? So it's always, if you have a healthcare provider, that's one of your key ways to get one, is through your own doctor. So people are starting to get notified by their clinics now that they're eligible, and to call and make appointments. Another way is to register in the vaccine connector. In the vaccine connector, I'll show you, here's a picture of it, is a way to put your information in, and you'll be notified. They look at priority and location and all that, and people are getting notified to get it scheduled. So it's a very, and we're asking if you have people that maybe haven't registered or have difficulty accessing or doing this, that volunteers are always, churches could, I think some of your volunteers could help other people within the congregation or communities to sign up. Also, we've started through the state, we have COVID community coordinators and for the different areas and different communities. So there is a link here that they can help with access to resources, signing up, and a variety. And then another way to get it is the vaccine locator map, where you can go in, and actually, I didn't update this slide, but I put it in St. Cloud because I was talking to a church in St. Cloud last week. But we could put in Columbia Heights and put it in, and I know that we're going to talk a little bit about a clinic that's being offered in your community here shortly. So that's another way, because Medicaid, the vaccine is coming in through federal, it's coming in through, you know, to pharmacies, to clinics, to community-based organizations. And I've got some more information about, and they're also really looking at how can we get it out into the community more accessible. They have taken, there are going to be some pop-up sites. There's going to be some mobile site buses that are, have been fitted to be vaccination sites that are going to be going out into the community. And then there's a special, let's see, I'm trying to remember where my slide is, about the new FEMA sites at the State Fair. I've got one here that I'll talk a little bit about that. I just included this just because when anything is going on, there's always people that do scams. So just to be aware that it shouldn't cost you anything. You don't have to put any credit card information in. Just always be cautious about who you're working with. So getting the vaccine, it's free. And it's recommended, as we said, for 16 and older. And it's you need to get both doses. And it's okay to take your time in deciding about that. And that's one of the reasons that we're here today too, is just to really make sure that people have accurate and true information and an ability to share where they're at and what their questions might be. It's really common when you get a vaccine, you have some side effects. Some people, I'm sure within your own circles, within my circle even, I mean, some people after the first one didn't even know they got it or maybe had a sore arm. The second dose, there's a range from some people who didn't have any symptoms at all to I had a couple of friends that were pretty sick for a couple of days in a row. So it really just depends. Fever is less common, but it means the vaccine is working. Your body is working to make your antibodies and it goes away. I mean, usually within 1 to 2 days, your symptoms have resolved and you're feeling fine again. And so it's really the rare allergic reactions, serious adverse events that we've heard of that, and that happens with any of our vaccines. So this is just sort of summarizing key information about the vaccines. Oops. So when you get the vaccine, we know that it's protecting you, but you still could get COVID-19 and be a carrier of the virus to others, even if you don't have any symptoms, which is sort of like, what? But just to know that usually you won't get as sick. And so now that you have been vaccinated, you've got great protection. You're not going to really what they're espousing is that it protects you from being hospitalized or dying if you get exposed to it. And you can get together with other fully vaccinated people and a household of low risk people without masking and distancing. But it's still, we're going to need to continue our behaviors of when you're out in public, maintaining 6 feet distance, wearing a face covering or masking when you're with others that aren't in your household or your pod, continuing the importance of good hygiene, good hand washing, Monitor the CDC website. International travel isn't advised. And if you get exposed, you want to self-monitor for symptoms. Always self-monitor for symptoms. And if you have any symptoms, stay home. Always stay home. I think that's been a big thing with this. It's like we used to say, oh, the old mentality of, you know, I can suffer through this. I can go, I've got a cough, running, sneezing or whatever. And you just expose other people. So it's really protect yourself, protect your family, protect your community. Here's a great thing that has been a vaccine campaign, is just like in promoting vaccines. Vaccine is love, vaccine is strength, it's hope for the future, and protection. So this is from the CDC website. I just included that so that you can remember now that you're fully, if for those of you that are fully vaccinated, that you can visit inside a home or private setting without a mask with other fully vaccinated people. You know, you can be with setting without a mask with one household of unvaccinated people who are not at risk for severe illness. You can travel domestically without pre or post travel test, without quarantining after travel. And then you can, about international travel, and you can attend a medium and large gatherings. So we know here in Minnesota, they have put a capacity limit on, like Alliance Field and Excel Energy and some of the larger things about capacity. I added this at the last minute. This is my card, but you want to make sure you keep your vaccine record card. Keep it in a safe place. They really say take a picture of it. I was just reading too, they said don't laminate it. It might, because then it might ruin the ink. And also, who knows, we may need to have boosters, so you'll want to be able to have that. And one of the tips that I was told is if you take a picture with your phone, mark it as a favorite, and that way it'll always come to top when you look at it. We're looking for it. One of the key things that have been added to the MDH website too is vaccine data, where we're at as a state. And we're up to 50% of 16 plus with at least one dose, which is good, but there continues to be discrepancy in ethnicity and race. So we could see that some of our counties, if you look at the state, the blue shadows sort of say where people are, where is it? A lot of people vaccinated, where aren't they? So now one of the key things that this is new, and it's just coming out this next week, is through FEMA, Minnesota got additional doses of vaccines, and it's specifically targeted to those zip codes that you see on there for Hennepin County, Ramsey County, Dakota, and Anoka County. And so there's a phone number that can be called, and you can schedule an appointment. You can get a bus pass printed for the day because it is accessible by public transportation. You don't need to have, do not need to provide an ID. You don't need to have insurance. You do need to wear a mask and social distancing, and they'll ask you for your self-identifying information when you get there. And there's an opportunity for privacy if you have any concerns. And it's appointments available April 14th through June 9th. So
Yep.
please.
Just to interject,
Yeah.
Heights is on the list, and I put this out last week in information for our people at First Lutheran, but 55421 is Columbia Heights, so we are eligible.
Yeah, so that's a great resource. Yeah. So it's extra vaccination doses that are coming into our state specifically for this. So let's see what else. I added this too, because when we look at vaccines, there's a difference between vaccine hesitancy, the people that are really sort of like trying to figure out if they want to get it or not. So it's delaying acceptance or refusal. And really those who are unsure, have questions or concerns versus there are people that are anti-vax that are actively against vaccines. And I just wanted to recognize that it's a complex issue, that, you know, we have our individual factors of our own beliefs, values, knowledge, emotion, perception of risks, and how do we feel about it? I mean, do we have accurate information, or have you heard misinformation or miscommunication? And what has been your experience, your medical experiences? So how confident are you? Or is this more of, you know, it's like, whatever, you know, is there a complacency or a convenience issue with this too? So, and then you add in all the political, historical, cultural, and social factors. So it's really, everyone has to make their own decision, but part of this is really, as I was talking about too, is just transparency and having open communication. And I mean, I don't feel that when you look at the population as a whole, who we can make a difference with is our vaccine hesitancy people. The anti-vax people are have their own, you know, platform and are actively sort of spreading the word against vaccines. And I'm not prepared to totally deal with that. So it's not my purview per se. This is here, it just shows you what is herd immunity. So part of it, as we talked about getting the vaccines, is the idea that you're doing it for yourself, for your family, for your community. And I don't know if you can see closely, there's a little black dot in the first square. And that's what, and so if you are that person, everyone is eligible to be exposed to it, to get it. And then as you can see, as we get more people vaccinated, then the likely the ability to develop the disease does decrease. So I'm not sure what they're saying. I mean, we don't know for sure what percentage is going to be needed for herd immunity for this, or when we're going to go back to normal per se. I think normal is going to be relative to many things. A lot of people have been asking questions about the COVID-19 variants. So we know that right now there's 4 variants that have been identified in Minnesota, and they're becoming more dominant. And the one that you've been hearing probably the most about is the B117. And it's over 60% here in Minnesota. And it's spreading faster, it's more contagious, but it's looking at how effective the vaccines are with the variants. It seems like it is working for the most part, from what I've heard, unless you've heard something differently. But also that many people are testing and they don't have any symptoms. So then if you don't have any symptoms, you could in a way expose people that have not been vaccinated. So that's where it gets back to your behaviors of masking, distancing, staying home. And the longer the pandemic continues, the more variants they're going to be, because that's what viruses do. They want to stay alive. They're going to mutate so that they can continue. Just the importance of testing. We're talking so much about vaccines that we forget that we do still need to encourage people to get tested on a regular basis if you've been exposed, if you have any symptoms. We know that kids in the school system are getting tested at regular basis, every 2 weeks or so. If you've got family members in sports, they recommend testing for every other week for the whole family and household. So it's still really critical that we don't forget about testing. Then I included this because I think it's a great analogy of just showing that these are all different ways to mitigate risk. You know, you've got your personal responsibilities. You're staying home if you're sick. You're physically distancing, wearing your mask, doing your hygiene, avoid touching your face. If crowded, watching your time, doing your testing and tracking. You have good ventilation in your area. You're outdoors versus being indoors. We've got our government messaging and financial support, and our people quarantining and isolating. And now we have the vaccines. But if you think about it, there still might be a possibility that you could still get it, because it's a Swiss cheese effect. There could be just that right hole going through all those layers that still might come through. But we know that the more layers we have, we are improving success. But each intervention has some imperfections. So at this point, I just want to reiterate that the vaccines are safe, proper safety and testing procedures were followed, that it works, the work won't make you sick with COVID-19. The supply in the state is continuing to develop. And of course, it's been now with Johnson & Johnson, that has obviously impacted supply, but it is free. And there's a variety of different ways to get it. And just to acknowledge too, that different people feel differently about vaccines. So, and then just to remember that we are still in a pandemic, that we still know that people are getting COVID and some are still dying. We got to stay safe until almost everyone is vaccinated. And they are becoming more available more quickly than they have been. So, but we don't know exactly what lies ahead. So we still need to continue our behaviors. I mean, we don't take our seatbelt off 5 miles from home. So we got to continue to our final end. Who knows? And who knows for sure what it's going to be and what's going to happen. We don't know. I mean, we can be we're hopeful, but then it's hard to know. So we have to continue to monitor the data and information and where people are at. That's what I have. We have questions. I don't have the questions up. You wanted to add some things about Columbia Heights. Do you want to add that too?
This coming week, Columbia Heights is hosting a free vaccine clinic on the 22nd and 23rd at the fire station. You have to pre-register at the time, and that will be on the 19th of noon to 6. And then they're offering the shots the 22nd and 23rd. They're also offering registration from 10 to 4 on the 20th and also 10 to 4 on the 21st. And then you would actually get your vaccine on the 22nd. So you'll come in and register, get a time, and then you will come back for the vaccine. It is free, of course, and it's only for Columbia Heights and Hilltop residents. And again, it's at the fire station. So if you know somebody, I mean, a lot of our First Lutheran people have been vaccinated, but this is a time where we can encourage our neighbors that are skeptical or just need a little nudge that look at your Columbia Heights is doing this for you, and it's free and easy to get to. They even offer, if somebody is handicapped, that a family member can bring their identification in and pre-register them also. And I would be willing, if it's ever necessary, if somebody needs a ride, I could do that for them to get this vaccine done. So just, that's all I have to say about it. And and then the vaccine connector is just a wonderful way to get your vaccines. And the state fairgrounds is offering 1,000 shots a day. That's a wonderful way to get your shot also. And your community is, included. So is New Brighton, where I live. All the neighboring suburbs like Roseville, Arden Hills, that kind of neighborhoods are
easy to get public transportation from too, if need be.
Yep, I know a 100-year-old lady that goes to our church, Helen. She took Metro Mobility to Regions and got her shot. And if Helen can do it, you can.
Wow. Wow, good for her.
Yeah, I offered her a ride. No, I'm going to take Metro Mobility.
Good for her. Great.
She's a dear.
Oh, sweet.
Anyway, any other questions, you guys? And there's nothing in chat, really.
Yeah, I didn't see anything.
No. Jill, what about you? Jill Kasny.
I'm writing a question as we speak.
Oh,
Okay, just ask.
Oh, all right.
Hopefully we can answer it. If not,
Well, one response that I got was that they knew someone that tested positive 2 weeks after their vaccine.
right.
Mhm.
And the question was, is that exposure or was that the result of the vaccine?
Yep.
I didn't really have a good answer for that. My guess was that it was exposure.
Yeah.
That's why, but I think that when I've heard people ask that question, that's the response I've heard too.
Uh-huh,
So it's not from the COVID vaccination.
No,
correct. That's, I was gonna say
Yeah.
that. It's not introducing the,
Right, right.
yeah,
Not a
okay,
it's not a live vaccine, so.
correct, yes. So, okay, that'll be
Yeah.
my,
Yeah.
to that.
I
Thank you.
know. It's so, the question, I mean, some of it is sort of like, okay, I have to sit there and think about that and yeah, contemplate this. So anyways. Was that helpful? Did that cover the information you feel like?
Yes, yeah, that's, I mean, it kind of confirmed what my understanding of
Yeah, feel free to use
Or-
any of the slides or,
our immune system.
yeah.
I took lots of screenshots. So
I do the same thing.
I didn't think of that.
But I hear things. I was like, oh, I really like that.
Uh-huh.
yeah,
Yeah. There was a really good, the School of Public Health, Minnesota did a health disparities roundtable Friday morning. And that was a really interesting
Mhm.
good conversation too. So,
Mhm. And I like that at the fairgrounds, you don't have to show identification.
right,
You
right.
never have to show insurance, really. Some of them
No.
you did have to take a picture early on of your card.
Yeah.
But, like I have a neighbor that he's probably illegal, or at least he's not a citizen. He's from Spain. And so I just sent a picture or I printed a info for the state.
Mhm. Oh,
so
good.
he knows, that you can go and don't be.
Mhm.
He's doing I think I'll wait until everybody else gets it. Well, that means you're not getting it. So
No, just do it.
yeah, I know.
Yep, just
He
do it.
works full time, so
Yeah.
So I just want everybody to get it done. And I talked to somebody else at the after school program where their son is not getting it. And he's a Marine, and I've heard 40% of the Marines are not getting vaccinated. And it's just sad. And it's like,
I know.
yeah, it's just,
Hey, I'll be honest, my 31-year-old son
oh yeah.
really is sort of like going, well, I'm going to wait for a little while still.
Yeah.
And oh, Michael, please.
Yeah,
This is what I do for.
I know.
I said, if you want to go see grandma.
Yeah. And I got my son on my vaccine connector, and within 2 days, he got an appointment, he and his
Yeah.
girlfriend.
Well, I'm going to keep working on him. Let me tell you.
Yeah. I'll talk to the parish nurse and I'll set him straight.
Yeah, really. Okay. So yeah, no, I grew up in North Suburb. I'm from Anoka, and I went to Zion Lutheran Church. So it was like I was in a big Lutheran church. So I feel very comfortable with the Lutheran.
Yeah. Yeah, used to have a big parish nurse program there too. So
Oh, did they?
I think so. Yeah.
Oh, I think it's a wonderful resource. And I really it's like, I'm really thrilled that we are working together.
Mhm.
So I appreciate all the work that you do.
Yep. All right. Any other questions? Do we shut it down? Linda, did your son get a shot? She's on mute.
Yeah, he did. He finally got his shot, but
Okay.
the only I did is the one up in Duluth is
Uh-huh.
because he was paid to get the shot. by
Oh.
his employer.
There you go.
Well,
The
never
employer paid him. So he's an
Really?
employer, and otherwise he would not have gotten the shot. He was
Really?
not
Wow.
planning
Wow.
on getting it. So
Wow.
that kind of made me happy,
There you go,
Mhm.
Jill. Pay your daughter.
that's, That's a new angle.
Yeah,
Yeah.
there's a bonus
yeah.
involved.
Michelle, are you signing off?
Okay.
Oh, I
Yep.
just had a comment.
Oh.
Thank you for this, everyone. I encountered a billboard in Sioux Falls, put out by likely our anti-vaxxers in this area, that says something to the effect, you know that it is illegal to coerce or force people to receive the vaccination. And then some other comments about that this is, approved by the FDA as an emergency authorized thing. There's still experimentation, blah, blah, blah.
Lies,
It's
lies.
just so difficult to see that happening. And
Yeah.
then to encounter our parishioners who are delightful, well-meaning, wonderful folks who are skeptical and like, oh, I'm not going to take that vaccination. All kinds of reasons. Like you said, it's complicated. And the real challenge is, like you said, to be patient, to not react,
Mhm.
to try to
And
listen,
listen, yeah, yeah.
to figure
And
out
see where
what
they're
their
at. Be
concerns are.
curious.
Right. So I think anything we can do, we are definitely still fighting this battle. Nurses are on the front line all over the place, but I think those of us in the community do have the opportunity to perhaps, continue with the education and
Yep.
the encouragement. So thank you.
Well, thank you for giving me the opportunity to be
Yeah.
with you today. So,
Thank you. Well, appreciate that. This just popped up and my Rachel, our Sunday school director, all of a sudden sent it to me and it's like, oh, where'd you get that from? Yeah. So
Well,
somebody
good.
contacted the church somehow and,
Yeah,
okay. Well,
okay.
all right.
Thank you.
I think we're done. Thank you.
Okay,
Thank
take
you.
care, everyone. Have a good
Thank
day.
you.
Bye.
Thank you
Bye.
very much.
Thank you, Julie Wilson.
AKA Joyce Weaver.
I'm on, I have my phone on and my battery almost went dead on I thought I plugged it in overnight and it was not plugged in overnight. My darling husband ran over with my cord.
Michelle, do you have a question before you go? Oh, just say bye.
Bye, okay.
All right,
Thank
bye,
you.
everyone.
Yep, bye.
Thank you. Thank you very much.
And you're home now, Jill, Casme?
Yes,
Okay, good. Well, glad to see.
yep,
So,
yep. Just got home yesterday morning, so
okay. All right, well, call me
Great.
and update me sometime.
great, thanks. Okay,
Yeah.
thank you.
All right.
Bye.
Bye, Joyce.
I'm signing us off, guys. All right, bye.
Okay, bye.